Hi, welcome. It's me, Dr. Khaled Sadek, and you're watching my fantastic YouTube channel on cysts and lipome removals. And today we're filming from the beautiful English city of Oxford, famous not only for its university, but the rivers, its beautiful architecture, immense amount of history, 500-year university. Today they've got off Christmas market. I will show you clips around this beautiful architectural city. I've got behind me the Bodleian Library. I've got fantastic colleges across this wonderful architectural delight. In the next clip, we've got beautiful, fantastic cysts. Remember, if you've got a similar skin complaint or anything else you've seen on my YouTube channel, then please don't forget to contact me at lipomacyst.com. We'd happily assist, give free advice, bring you in for a consultation and give you the treatment you need. So if you haven't done so already, don't forget to comment and subscribe and like. And if you have subscribed, don't forget to press the alert button. But most of all, until next time, enjoy the video. Bye-bye. So what I'm going to do is just examine this. So it's very big. It's about sort of 5 centimeters by 3. It's very fluctuant. It's very soft, as we can see. So the first thing I'm going to do is obviously clean it, but then insert some local anesthetic to numb the area. So when it is infected, the anesthetic can be less potent because the pH changes. So what I'm going to do is just put this underneath the skin, sharp scratch. And really what I want to do is just make enough anesthetic in there to carry out an incision and drainage. Because when it gets infected, as we mentioned, the cyst sac itself just dissolves. So it's very difficult to then go out and remove it. So with this procedure, it's incision. You okay?
Yeah.
Well, incision, drainage, and then packing. And that's to let the skin close through secondary intention. And that means healing from the bottom up. Okay, so hopefully we've got a little runway there for where we want to inject. I'm going to put a drape because this is going to be a little bit messy when it comes out. Okay, you okay with that?
Yes.
Okay, brilliant. Okay, so if you feel any pain, let me know, and we'll give some more anesthetic. So, you're feeling any pain or just pressure?
Just pressure.
How long has it been here?
I've had it for like 6, 7 months. But
7 months, okay. Yeah.
Last month.
Just suddenly got infected, yeah. Yeah, it's very common for them to become infected because the oil is so rich in calories. What I wanted to just gently open it. You'll obviously get to watch this later if you want. I know you have in the past, so that's okay. So what I wanted to do is just gently open it, just see if we can see the sac, and hope to try and retrieve it, because the last thing I want to do is pack this thing because it takes a long time to heal. You okay? Oh, okay. So it's just draining now, actually, and it's this chocolate-coloured discharge, which is basically pus, blood mixed together. It really needs kind of drainage, and that will give you some temporary relief straight away. And you can see it's just very much this chocolate-coloured substance. Let's see if we can just get a bit more access into that. Okay, so there's a bit more stuff coming out there, okay? So there's a large volume collection there, okay? Let's try and just empty that all out. You can see some of the debris from from the original cyst coming through there as well. Okay. Hubby's come over to have a look. This makes it a bit bigger actually. Sorry, you okay?
Yeah, it's a bit pressure.
Yeah, there's a bit of pressure, but you know, this thing is very, very deep. Okay, I'm just going to give it another pressure to get this stuff out, okay? It's another kind of endingness, isn't it? There's tons and tons. Okay, so really next step is to see if we can get hold of this dissolved sac.
I feel pinching though.
You can feel pinching. Give you some more anesthetic, yeah?
Yeah, please.
Okay, okay. Let's see. Okay. Just going to infiltrate the skin some more. As I mentioned, the anesthetic can sometimes be less effective when there's this concurrent infection going on. Okay, I'm not going to do any more cutting. I'm just going to try and just clear this out, really. Just pressure, okay, because I think there's just a bit more deeper inside there. You can feel me tugging that little pieces. Okay. Okay, okay, all right. Okay. Just bear with me, I put some more anesthetic. It's just that fact that it's infected is going to be a bit of a trick getting optimal pain control, but you're doing really well, okay? What I want to do next is using my curette to just try and clear the inside of it out. As we mentioned, blood clots there coming out with more of the debris. It's just bear with me, just trying to get this stuff out. How are you holding in there? You okay?
Yeah, it's just a bit painful.
A bit painful, okay. Try and get some more anesthetic in as well. What I need to do is just try and debride this, okay? Just get this stuff out. You're gonna feel a little bit of pain just because the anesthetic isn't optimal because of the infection, okay? But what I want to do is just make sure that there's no debris inside. Okay, well done, well done. No more of the deep stuff, okay? Just want to get this gooey stuff out. There's remnants of this dissolved sac. Also, I'm going to want to irrigate it with some solution. Yeah, that's fine. So what we're going to need to do is actually just pack it.
Okay.
And then we need to replace the packing every other day, every day. For the first week, I reckon probably every day. And then the subsequent weeks, a little bit every other day. It's just very deep. But we have sort of drained it, washed it, debrided it. So it should feel more comfortable in the long term, and definitely needed to come out. There was just an incredible amount of abscess in there. There's more debris coming out still. Let's get that stuff out there. There's just more debris just coming up to the surface from the wash. Well, if we can clean it out properly, we might be able to close it. I'm really tempted to try and close it actually. Then pack it. And because it does look quite healthy inside now it's been cleaned. I think some more cleaning and we'll make an assessment as to whether or not to open or close. Do another washout. Okay, just going to do another washout. Good, now we've washed it out, it just looks so much healthier. You can see red tissue underneath. I think you're feeling more comfortable. And the salty water sometimes just causes all the blood to kind of stop bleeding. Like I said, there's a high risk this is going to reoccur because, you know, the sac is dissolved and it's in little pieces in there. And as hard as we do try to wash out and pick out all little pieces, it will reform. You're feeling more comfortable, aren't you?
Yeah.
Good. I'll tell you what, is I'm going to try and just do a quick curette inside, and then I suspect I might just close it. So what I'm going to do is just curette that inside. Sorry. This is a bit deeper. You can see it's got like a 7mm loop, and what we do is just try and pick up all the debris that's inside there. Because it's attached to some of the deeper muscle, that's why it's hurting a little bit. You're doing very, very well, okay? Maybe use a toothed forceps to just pick some of this stuff out from the base. Okay. Let's just make sure it's all dry inside, and then we're going to put some stitching in, and then you're going to come and see me in a week, okay? I'm also going to start you on some antibiotics, just to cover any residual. You've done really, really well. Considering what it was, it's come down beautifully. So what I'm going to do here is put some interrupted stitching. So it's not going to be underneath the skin like you've seen in some of the other clips, just because any discharge, I do want it to come out. We'll probably just put 2 or 3 in there. Okay, well done. You okay?
Yeah.
And what I'll do is just take this drape off, give it a slight clean, and then put a nice big dressing on there to cover it up. You're not allergic to anything, are you?
No.
Okay. Let's just see if we could see what that looks like. Looks fine. Okay, perfect.